So Commissioner, let's just kind of dive right into it. When you looked at the report, what was your reaction to the findings?
Sure. So we, backing up a little bit, we're excited to be able to have Casey family programs agree to do this report with collaborative safety, because it takes an approach to evaluating what goes on in a different way. It's called safety science. It's what we've seen in the airline industry and different industries that looks at the data, and this group had access to all of our case records. It does interviews to find out what happened when in the real world in these cases, and then it does a system mapping. So we got from Casey Foundation in a 90-day period of time this set of recommendations, 7 recommendations that are about the system. So it does take a systems approach, which is what we want to be able to dive in and figure out how do we make sure that our system is working well for the children of Maine.
Were you surprised? Oh, I'm sorry, I didn't mean to cut you off. You were going to say something else?
Nope.
Okay, were you surprised by the findings?
We learned from them for sure, because I think what we have realized throughout this pandemic that many of the connections that are critical to understanding and evaluating what's going on in real time had frayed. So the recommendations including, for example, said law enforcement communications with child welfare workers in our hospitals was frayed, and that was causing misinformation and maybe missteps in what goes on. So that was a recommendation that we are immediately acting upon to make sure our protocols, our rules, our training is in place to make sure those communications happen well. Another one that wasn't much of a surprise is that we know many of our families have experienced increased anxiety, mental health stress, and substance use disorders in these past years. What we did learn was that oftentimes the providers that we send those parents to get help were considering the information that they got from those parents as confidential and not able to share some of the findings with our child welfare systems that would protect those children. So we are also going to be working with those providers to reinstate ways to share information to keep kids and families safe.
I mean, because that kind of stuff, whether it's substance abuse or mental health struggles, those would be important for a caseworker to know, right?
Absolutely, absolutely. This builds upon, though, our efforts over time to really look at our system. So in 2019, we developed a strategic plan. It included overhauling a very outdated information system. So we are on track, on budget to launch a system this winter called Katahdin that'll give our caseworkers information in real time, but we also want to make sure that all these human connections are also working well. Those are some of the recommendations. We're acting on over half of them. Some of them are new, some of them are accelerating work that was already in process, but there's more that we'll be looking at in the coming months.
Gotcha. I'm going to just make one quick change on my cameras here and then I'll keep going. Sorry.
Sure, no problem at all.
Sorry about that. I apologize.
No problem at all.
Usually, I should have thought about that beforehand. So why did you start with the sort of the actionable items that you did?
Because we take seriously any concerns about child safety. Our number one responsibility is making sure children are healthy and safe, and to the extent that there are actions and improvements that we can take now, we will do it. But we started doing that in July after the month of child fatalities, which was so devastating for the state of Maine. That builds on the work that we've been doing, and it's not the end. We look forward to digging into the additional recommendations in this report, hearing from others. The Child Welfare Ombudsman will be doing her own investigation and annual report. The Office of Program Evaluation and Governmental Accountability also will be reporting to the legislature in January. We look forward to that report. And we will be working with our committee in the Maine State Legislature to see what, if any, legislative or budget changes are needed to continue our aggressive, intense work to improve our systems to keep kids safe.
Okay. One of the issues that I can imagine is very difficult to tackle is the caseload for caseworkers. That's one of the recommendations from this most recent report. How do you get at that? Is it increasing your staff? I would imagine that's probably got to be the primary one, right?
Yeah,
we also talked a lot about, the report talked a lot about turnover, and then it was a cyclical, right? Somebody takes on more cases because more people are leaving, because they're stressed out, because their caseload is so high. How do you address that?
So This was an issue in 2019 when Governor Mills took office. We had really seen a reduction in our workload, our workforce, and increased turnover. We've since then added 60 new caseworkers or child welfare workers across the system. We reduced our turnover significantly. So in 2019 or 2018, it was in the 26% range, and that dropped down to in the low, I can give you those statistics. I can't quite find them.
Okay.
I know I have them somewhere. I don't want to give you
Take your time to
wrong
find it,
numbers.
because we're not in a rush.
Yeah.
At least, not mine, I don't know what you guys would do. I know you have 11 o'clock. So.
Yeah, there it is. So we reduced our caseworker turnover from 23% in 2018 to 16% in 2020. Now, with the recent stress of the pandemic, that may be going up, but we do continue to work to try to figure out how we can increase the capacity in our team to do this, but also streamline the process. One of the recommendations out of this report is making sure we look hard at our timeframes. When does a report have to happen, as well as what might be unnecessary to try to take out of that workflow activity that may not be all that value add, while making sure that the quality work that is needed to figure out what the next steps are for our child are quality. So we are continuing both of those efforts.
Gotcha. I mean, as you mentioned, this was an issue that we've known about since 2019. You guys have taken some steps since then to add more caseworkers.
Yep.
But this report is now talking about 2021.
Yep.
Are you concerned about the future of the child welfare system if this doesn't take a sharp turn in the positive direction?
So we've had to intensify our work in child welfare, in behavioral health across all of our systems during the pandemic. I mean, the inability to do as much in-person work during the pandemic has taken its toll. The inability for us to be able to recruit people as much as we would like has been affected by the pandemic. So it's not just child welfare, it's all of our systems that we have to do some extra intense work on. But we are confident that with a good plan from the beginning, with lots of stakeholder input, with these recommendations from the Casey Family Foundations, as well as those coming from the Child Welfare Ombudsman and the Office of Program Evaluation and Governmental Accountability, plus work with the Maine State Legislature, we have a path forward to try to figure out how we can really intensify the work given the increase in our challenges.
Okay. Change here. Did you want to add something?
Yeah, and just going back to this report, I think it is important just to look at what this is and what this isn't.
Okay.
You know, we have heard some criticism that it doesn't take on the issue of accountability enough. It doesn't really make changes. I mean, there's some who say it's yet another report, there's going to be some window dressing changes, things will just be the same. What is different about this report is the way they approached it. They did do, again, intense document review because they have the agreements for the confidentiality of the reviews to look at what actually happened, interviewed the people involved, not just read about it in different places, and we're able to do this kind of mapping that is consistent with what we've seen in different industries. So take airline industry. When there's an airplane crash, it's easy to blame the pilot. When a deeper analysis that really looks holistically the way this analysis did, we'll find it could have been the computer automation system that was at fault, or it could have been the information that got inputted into that system, or it could have been the training that didn't train the pilot when to override that system. That's what we're trying to do here, is certainly focus on accountability. We do that all the time. We look forward to the report from the legislative committee that's going to be looking at oversight and accountability, that too. But we're never really going to prevent the problem in the first place if we don't really look at the systems within child welfare, within behavioral health, in our schools, in our public safety, all of which are accountable and responsible for keeping kids safe.
I'm just going to fix that light and then
Sure.
we'll get right back on track. I apologize.
No problem.
The cold does sometimes mess with the batteries, and they were in my car.
Yeah.
So,
I finally got a new phone. I had an old phone from 2014 that in the winter didn't work outside. Did you
Yeah.
ever have that? Battery froze all the time.
Yeah, it's not super fun. I had times when my live shot would stop,
Here we go.
or my script mic in my ear. I would lose my
Oh.
contact with my producers because my phone would die because it's so cold. We just addressed that. And there's something else I was going to ask you, but I forgot. So let me, if you don't mind, I'm just going to move on to
Sure.
my next question. And Jackie and I had corresponded a little bit about this. One of the people who's listed on the front page of that report is Dan Despard.
Mm-hmm.
He has intimate knowledge of Maine DHHS and specifically child welfare. I reached out to Casey Family Programs about this because I wanted to know, is it common to have somebody who's doing an independent review have such close ties to the agency that they are looking at? And there are some people that are concerned it's a conflict of interest. Do you see it that way?
Sure. The group that did the hard work was Collaborative Safety, which is a contractor to the Casey Family Programs. These are child welfare experts that also have studied this science of the safety science literature about how you approach this. In their own review, they included the Child Welfare Ombudsman, they included the staff from OPEGA, they included a lot of the people who have independent views of the challenges in the system to make sure that their information was inputted. Their methodology is clearly written out in the report that came out. So we feel confident that it is an impartial review. We also do look forward to the other reviews because we welcome ideas and suggestions. But I would note that this particular report had the insight into some of the documents that we can't necessarily release by statute to the legislature or different public groups. So it does have that kind of input, which I think is important, as well as the kind of on the ground discussions with the people involved. So we think that the methodology was good, the input was good, and some of the recommendations are critical. I don't want to sugarcoat this. I mean, there's hard work to be done to implement these recommendations, and we started that work this week, but there's much more to come, including some changes that may require legislation so we can be more aggressive in our work in child welfare.
Okay. I know that one of the other recommendations, or I guess findings in the report, was sort of this struggle to engage families, caseworkers engaging families.
Yep.
And I think it comes from a lot of different aspects.
Correct.
I think one of them was there was reluctance on a family's side to engage because of maybe a perceived stigma of working with child family services. And I don't want to misquote it, so I won't address that part, but how would you improve the relationship between families and caseworkers to address
Sure.
that?
There are two major approaches that we're working on. One, which is part of these recommendations, but also recommendations we've heard from other different groups. We have a child welfare advisory committee that has also made this recommendation, is getting parents who've been involved in our child welfare system, helping those parents who are new to the system, explaining what the goals are, why it's not supposed to be confrontational, why it's supposed to be constructive, and how they can constructively get through this process, because the vast majority of people that we're involved with love their children and want to keep their children safe, but need the tools and the supports to do so. So we'll be hiring people who have been in the system to work on our training teams, having them help us create a mentoring program, knowing that they're the ones who have the experience and they may be best to advise us, but that's just the beginning of our ideas on how we can engage families more. On the other side of it, our own teams, we're hoping, can, with training and engagement themselves, figure out more constructive ways to engage with these families, so it feels, again, less confrontational, more collaborative, towards an end goal of keeping that child and that family safe.
What would you say to families who are, at this point, even with the report and the actions that you guys have started to take already, distrustful of the system, or, as we've mentioned a second ago, have a stigma about the system? What would you say to those families about the work that DHHS intends to do going forward?
Yeah, I would say that we view every child's safety as one of our top priorities. We also view any harm to a child, especially a death of a child, a tragic and terrible incident that affects families, communities, and the state as a whole. So our mission here is one we hope that they can share, which is how do we ensure that our children grow up safe and healthy, and their participation in that is crucial. So we do hope that they recognize that we come at this with an intent to keep them and their children healthy and safe. And with that in mind, collaborate with us, figure out ways that we can do so, give them the supports that they can do so themselves, or find alternative placements for those children.
You need their help too.
We do.
Okay.
Thank you.
I'm out of time at this point.
You are, because Jackie's standing here
and
waiting.
I just want to be cognizant of that.
Yeah.
If there's anything that I didn't cover that you want to make sure we mention before you go.
Well, I will always say that, taking care of Maine children is all of our responsibilities, while child welfare is part of the system. It's not the entirety of it. So if there's somebody who suspects child abuse or neglect, they should not hesitate to call. We have a 24/7 hotline that is at 1-800-452-1999. Those calls are anonymous, so we urge anybody who does suspect that a child is at risk to call.